The healthcare dynamic is rapidly changing. Understanding the basic fundamentals related to the business of medicine empowers practitioners to advance their skills in and knowledge of the business aspects of medicine. SMA's Business of Medicine Simplified program explores the essentials of everything from reimbursement and compensation models, insurance and risk management, to practice employment and business finance.
Good afternoon, everyone. My name is Andy Mohan, and I'm currently the co-chair of the Division of Digital Health and Innovation at the Southern Medical Association. I also have with me Ms. Jennifer Price, who is the SMA's Education Manager and will be the moderator for this discussion. We have a very interesting topic for this podcast, introducing a new product that is being piloted at Vanderbilt University Medical Center called VEVA, which is essentially a voice assistant for electronic health records. I would like to take this time to thank and introduce the two speakers and experts that will go in depth on how they help create this game-changing software. So first off, we have Dr. Yaa Kumah-Crystal, who is the Assistant Professor of Biomedical Informatics and Pediatric Endocrinology at Vanderbilt University Medical Center. Dr. Kumah-Crystal's research focuses on studying communication and documentation in healthcare and developing strategies to improve workflow and patient care delivery. Dr. Kumah-Crystal works in the innovations portfolio at Vanderbilt Health IT on the development of voice assistant technology to improve the usability of the EHR through natural language communication. We also have with us Mr. Tim Coffman, who is the custom application developer for Vanderbilt University Medical Center for more than 10 years and is currently leading the Vanderbilt EHR Voice Assistant development. He's focused on applying smart on fire interoperability standards to health systems, increasing patients and providers access to their health records wherever they go see patients. So without further ado, I will hand this over to Ms. Jennifer Price to kick off the discussion.
Thank you, Andy, and thank you everyone for joining us today. Let's jump right in. We're all very interested in learning about this. So first off, where did this innovative idea come from?
Thank you so much for having us. So the idea for VEVA just came from some of the frustration I myself as a provider faced, and what I heard from my colleagues as well, just trying to find information in the electronic health record to understand the patient's story. Unfortunately, our electronic health records are organized about as well as my desktop and my documents folder, where you have to click around several disparate documents and tabs and folders just to get to the information you need. And sometimes you're just trying to get a global understanding of what the most acute event happened to the patient was, or what their vital sign trends are, or what a certain lab is. And it just takes so many steps and so many clicks to uncover that information. And it just seemed like with the technology that exists today, this should be a much easier process. I remember back in 2011, when I first got Siri on my phone, thinking it should be as easy for me to find out information about my patient as it is for me to ask Siri the weather. And that's where this idea first stemmed from.
That's excellent. Tim, is there anything you would like to add to this?
Yeah, absolutely. We're all getting experience with voice assistants on our phones and in our homes, and naturally, as a developer, we want to extend those benefits to people working in health records as well as lots of other places. There's plenty of opportunity to apply algorithms which help people get exactly what they want when they state it as simply as talking to their device. So we're ready to go.
What are some of the challenges that you see with this technology, or potential challenges?
So the most interesting challenge that we face designing a voice user interface for the electronic health record, I'm sure is the same challenge developers for Siri and Alexa and the Google Assistant have all faced, is that there are a lot of expectations that surround talking and interacting with another person, and it's very unclear what the parallel should be when you're talking to a device. So for when you ask a question to another person, there's a expected time span where you'd expect that they respond back pretty much right away. And with a machine, sometimes when you're searching for a website, there's latency, sometimes there's buffering. But when you ask a computer a question and there's this latency and buffering, there's no real parallel to that when you're speaking to another person. So it just feels awkward and really disruptive. So trying to kind of meet people's expectations for how communication should occur when you're interacting with the device and how that parallels communication when you're interacting with another person has been one of the most interesting challenges we've been working on addressing. And latency specifically to make sure that the answers and the replies back we get are as robust as you would expect when another person would answer something for you.
As we extend this sort of thing out into the real world in the hospital, the hardware that's there, the devices they have on desktops, are not necessarily ready to go out of the box. While there's plenty of dictation where the computers will be ready to listen to what you have to say, audio feedback coming from your health system they're just not ready for it necessarily. And so getting the right equipment out there that has speakers that can talk back to you and in a reasonable volume, and match that up with microphones that are going to hear your dictation or your questions to the interactive system correctly have been a real challenge.
I can only imagine. I mean, this is very, very fascinating, and I can't wait to see how this all comes to the forefront. What are some new features that will be incorporated in the future as you look to build upon this?
One of the new features that we recently built in that I'm most excited about is the ability to inquire about health maintenance labs that are due on a patient and order them right from VEVA. I think one of the benefits that technology can afford to us is making kind of the rote, tedious manual tasks that we have to do as providers automated, so we can worry about thinking about the more complex nature of patient care. So health maintenance is based on so many different variables, such as how old the patient is, how long they've had a diagnosis, when it was last ordered, the results of those last tests. And in order to come to the conclusion about what a particular lab a patient is due for, you have to, again, hunt and peck through different tabs in the chart to put all that information together, all to come to a true-false conclusion about whether the patient is due for a lab. This is one of the perfect examples of something a computer can do well and offset so the provider doesn't have to waste their time doing some of these tasks. So right now in VEVA today, you can ask, what health maintenance is this patient due for? And for a patient with pediatric diabetes, she will serve up to you the labs that they're due for, and you have the ability to order it right there.
If you look at health records today, they are fairly passive with some clinical decision support popping up in the middle of what you're doing. But when you have a conversation with a person, and now as we're extending this to machines, you really expect to have a more human model going on where the computer really understands sort of what you're talking about, what you need to know, what you're likely to do next. And our phones and devices are trying to do that now. But we're going to be extending that further and further as we go. One of the more complex questions that we anticipate answering is, well, what else do I need to know? That's a very open-ended question. And unless we model specifically what you personally have already been told, what you might need to know in your specialty, we won't be able to answer that. So customizability is going to be essential. Each discipline, each person is going to want slightly different things. And the more we can bring that into line with exactly what you want, the better, because no one wants to waste their time listening to a computer speak at them stuff that they're not interested in.
How long does it take from conception to bring this to the forefront? I mean, because this sounds absolutely amazing, and I'm just wondering, from a person with a medical background but not in the trenches with the records, I mean, to fully appreciate everything that you have done to build this, how long has this taken?
So I think the whole initiative has been going on for a little over 2 years now, and it just started with the idea that, well, let's do a proof of concept to figure out if we can even draw information from the computer in a way where, if it's spoken, our text, the words that we're saying, can be transcribed into text. That text can be fed back into the computer can understand it and could create a certain fulfillment to feed back information that we can understand. So from the very beginning, we just wanted to prove that that was even a functional capacity our computers would have. And we explored lots of different existing technologies that had interfaces for natural language processing. We looked at the Amazon Echo interfaces, we looked at the Google interfaces, and some of the issues we ran into is a lot of consumer interfaces that do this very well were not HIPAA compliant. And then we were fortunate to come upon Nuance's interface that allows us to do some of these exchanges and allows us to create the back-end fulfillment, which is satisfying the request in a HIPAA compliant way.
Does this integrate with all electronic health records, the full spectrum?
One of the design principles that we used early on is whenever we can, we're trying to build out the fulfillments as smart on fire applications so that it's agnostic to which EHR that you're using. Unfortunately, and Tim can definitely speak more to this, the elements that are supported on Smart on Fire have not been robust enough to handle all the different data elements that we'll need. And I'll let Tim speak more on that.
Yes, Dr. Kumah-Crystal is exactly right. The FHIR standard that we have available, that is I think most widely available at the moment, defines almost everything you might need, but support among the different vendors is still a little bit scattered. So when we find that our particular vendor for our EHR has not yet implemented that aspect of the FHIR standard, or where it's not gotten it quite in line with the global definitions, we have to go back, fall back, find other ways to get the information. So this then ties it slightly more to your EHR vendor. We're hoping to break free of that as much as possible because we'd like to get this into as many hands as possible.
For the benefit of our listeners, Smart on Fire, many of us may not know what that is. Can you just kind of briefly describe what that is for us?
Sure, it's an evolving standard. It's now on revision 4. Providers and technologists across the country, across the world, are collaborating on this as a method for letting different EHRs interoperate with each other much more easily. As long as we're all speaking the same common language, in this case it will be FHIR, F-H-I-R, they will be able to do that much more seamlessly, much more quickly, and develop new solutions for people.
This has been a very interesting discussion. And before we conclude, are there any final thoughts, points anyone would like to share that we may pass along to the listeners?
This is just such an interesting emerging field, and we're just really excited about the opportunity to be working on these new interactions, and are really excited for others to be getting into the field and really exercising the system to figure out what it's able to do. I think one of the really neat things that we're going to be able to explore in the future are using these tools with our patients in the exam room, and how it allows us to be untethered from the computer and really engage with our patients. And when there's a need to order labs or look up information, we can simply ask and call out to the air as if there was a scribe there with us, and not always have to turn to our computer screens to interact with the computer. So I think voice presents itself as an alternate modality that allows us to use other senses besides our vision or our touch in order to communicate with computers. And I think that potentially will let us have more engaging patient interactions in the future.
I'm really looking forward to the responses we get from different people using it in the field. Every time that your voice response systems comes back with, I didn't quite understand that, or I can't quite do that yet, is an opportunity for us to learn what people want to do, what kind of things they expect. And the more naturally you can speak to something, the more naturally you're going to ask for more things that, while it can't quite handle it, we want to be there and ready to expand those capabilities.
Can we circle back with you? And I don't know what the time frame is and what how things are developing and what you guys are going through right now, but can we circle back at some point and maybe do a follow-up discussion on this at some point?
I would love that. In the spring, we should have more data about how it's being used and other new skills that we've been able to develop over time. And we'd love to report back.
Absolutely. Okay. We'd love to hear it. So we'll just make plans to follow up in the spring and see what's been happening.
Well, if you want to put in a change ticket so that I can develop the podcasting module, we'll invite VEVA onto it.
That's a great idea.
Absolutely. Yeah. Thank you guys so much. Yeah, it's so great to hear your voice. Tim, I'm not sure if we've met before at VUMC or at the Biomedical Informatics department, but if we haven't, it's great talking to you and interacting. And yeah, we look forward to the spring and reconnecting.
It's been a pleasure. Thank you so much for giving us an opportunity to talk about our research.
Thank you again for joining us. To subscribe or to listen to additional SMA podcasts, please visit sma.org/podcasts.